I'd also like to introduce Dr. Caitlin Crandall. She received her Doctor of Physical Therapy degree from Sage Graduate School in 2018. After practicing in school-based pediatrics, she went on to be the first acute care physical therapy resident at NYU Langone Health, completing her residency in fall of 2021. Dr. Crandall is now a senior physical therapy at NYU Langone Health, specializing in critical care and is a board-certified cardiovascular and pulmonary clinical specialist. She's a published researcher with multiple conference presentations at both the state and national level. Her research interests include use of outcome measures in acute care, critical care rehabilitation, psycho-emotional aspects of critical care, and cardiorespiratory fitness. Dr. Crandall is also a registered yoga teacher with Yoga Alliance and horseback rider with a passion for yoga, therapy, and hippotherapy. Welcome, Dr. Crandall.
Thank you. Happy to be here.
Our final speaker is Dr. Louis Lupowitz. Dr. Lupowitz received his Bachelor of Biological Science from SUNY Binghamton in 2016 and went on to receive his Doctorate of Physical Therapy from Touro College School of Health Science in 2020. Following school, he completed a sports physical therapy fellowship through the American Sports Medicine Institute under the mentorship of Dr. Kevin Wilk at the Andrews Sports Medicine Clinic in Birmingham, Alabama. Dr. Lupowitz is now a practice physical therapist at Orlin and Cohen Orthopedic Group, an affiliate of Northwell Health, where he specializes in the treatment of orthopedic sports conditions of the shoulder, elbow, and knee. Dr. Lupowitz assists with the care of over a dozen local high schools, multiple collegiate programs, and the New York Riptide, a professional lacrosse league team. Dr. Lupowitz is a published researcher, textbook author, and manuscript reviewer for the International Journal of Sports Physical Therapy. He has presented at many local, state, and national continuing education conferences discussing his evaluation methods and treatment techniques. Dr. Lupowitz is also a certified strength and conditioning specialist, functional range conditioning mobility specialist with a passion for traveling and drinking coffee. Welcome.
Thank you. And as you guys saw, my apologies. I am still in the clinic, so if people are bouncing in, I'm going to mute myself. But happy to be here and looking forward to this experience with you guys.
Yes, and welcome to all of you. Is there anything that I had left out on the bios or the intros that you would like to add?
Awesome. Okay, so we will get started with our questions. So let's start with Dr. Lupowitz because he is currently sitting. So we've got him for a minute. So we'll start with you and then we'll move on from there. So Dr. Lupowitz, why did you decide to pursue a residency program and how quickly did you do this after graduation?
So it's kind of ironic. I was always telling myself as a student, I am never, ever going to do a residency. I have trained, I have gone through school, I have done X, Y, and Z. I'm ready to take on the world until I kind of got down to my last clinical and realized I was very wrong, at least from my perspective. That's how I felt. So I got relatively lucky in the sense that my final student affiliation sort of blended into a fellowship program. So timing kind of matched up in terms of where I was at in my life and where my mentor was at in his. So I went sort of straight from school right back to New York in September, graduated virtually, and went right back down to Birmingham in October. Took my boards down there. And sort of started my fellowship kind of prior to taking my boards, but took them down there, got a dual licenseship, and sort of went from there. So it was pretty immediate for me. And again, it was just kind of how the timing worked out with New York being on a hiring freeze with COVID and them sort of needing some help down there. I figured it was no better opportunity.
Awesome, thank you. Dr. Awesomes, would you like to go next?
Yeah, sure. So I have to kind of, reiterate what Dr. Lupowitz already said about, you go through school and you're like, oh my gosh, I've done so much school. I don't want to do any more schooling until you realize you have gone through physical therapy school with all of this knowledge, so much so that you almost are like, where can I hone in my skills? And that's what really drove me to want to pursue a residency. I felt like I had a lot to give, but I really wanted to specialize in one area. I also have a very personal connection to neuro. I had a family member that sustained an acquired brain injury while I was in PT school. And I saw the incredible improvement that he had made in response to physical therapy, occupational therapy, and speech. So that's what really kind of pushed me towards the neuro side of it all. And really doing the residency was one of the best decisions I feel like I could have made, as far as like my confidence in my skill set and just really feeling like I had the best up-to-date tools in delivering my treatment sessions. So
Great, thank you. Dr. Crandall, same question. Why did you decide to pursue a residency program, and how quickly after graduation?
Sure. And I just want to make sure you guys can hear me okay. My audio is
Yep.
beautiful. So I decided to pursue an acute care residency because when I was a student, my second clinical was at Bridgeport Hospital in Connecticut. And I had a little bit of experience as a student going into the ICU. And I really fell in love with critical care. And so obviously critical care is a very nuanced area of physical therapy, quite new. So I wanted to really hone my skills in the ICU, and I decided to apply. I applied while I was still in school. I did the interview like a week before I graduated, and then unfortunately NYU had a hiring freeze because they built a new hospital. So I didn't start until the fall of, oh my gosh, I graduated the spring of 2018. I didn't start until the fall of 2019 for my residency. And then had my residency through COVID, working in the epicenter of COVID. So that was fun. But yeah.
Wow, that sounds like it was very difficult. Great. Okay, so next question. What was the application process like for residency? Did you all have to interview, and did you apply to more than one residency? So let's go back to Dr. Awesomes.
So I didn't mention this before, but I did wait a year after practicing. So I practiced for a full year before I started my residency. And that was in part to when our hospital, I was the first resident, so they started a residency program. So I did only apply to one, that being the hospital that I was working for at the time. And I did have to, was more than one applicant. We went through the application process. I went through interviews with the PT supervisor at the time, the OT supervisor, and then the actual CEO of the hospital, who's it's a different CEO now, so I'm not entirely sure if they're still doing that. And then I'm trying to think. I know that, some people do apply for more than one residency. It really just depends. But again, just given my situation, I really felt like it was the right move to just kind of stay where I was. But I have friends that have done other residencies that applied to a bunch all over the country. So I think it really just depends on where you're looking to go and what you're looking to do.
Awesome. Dr. Lupowitz?
You guys can call me Lewis, by the way, like
Okay.
that. So yes, it was sort of a kind of rolling interview. My CI at the time had also done a fellowship, same program as myself. So kind of throughout my student internship, he was sort of probing at the possibility of doing a fellowship and kind of what it entailed, and was picking my brain in terms of if maybe I was a candidate. And then from there, yeah, I did have a kind of a sit down with Kevin, just in terms of kind of what my goals were, what his goals were, just to see that they aligned. I think that's the biggest thing is kind of with working with your mentor and making sure that they're going to sort of have the time that you're looking for, given the position as well. So we kind of came to an agreement that a certain time frame would kind of work. It would be mutually beneficial for me to learn from him, and for him to have another hand in the clinic during a busy time and a weird position during COVID, where not many people were working. So yeah, sort of more an informal process, being that it's kind of his own fellowship. So it didn't have to do as many rounds of interviews, which I was fortunate for. But more just a conversation and mini interview to sort of see that our goals aligned.
Awesome. All right. And then what about you, Dr. Crandall?
So mine was kind of the opposite. Mine was very formal. I applied initially, which included like an essay and 2 case studies. And then we had, or no, excuse me, it was just the essay at first. And then I had, I believe it was 3 phone interviews. And the last phone interview, they gave me a case presentation. And then I came down to the city for a 6-hour interview in person, which included presentations of the cases and touring the hospital and meeting a lot of the physical therapists there and supervisors into upper management.
Awesome. Well, so you all actually sort of mentioned this next piece of what program did you do, but could you talk a little bit more about the format of your residency program? So was it weekends, daily? Was it more of like an internship? Were you an independent employee with your own caseload? The format does vary across programs. So why don't we start with you, Caitlin?
Yeah, so mine actually started didactic. I think it was 2 months before I went to the city. And so I did all the didactic work on my own. I came down to the city. I didn't mention previously, but while NYU was in a hiring freeze, I did pursue a travel job in school-based pediatrics. So coming from like school-based peds and then jumping into an acute care setting is obviously a huge difference. So we started off with like a lot of mentoring hours where I was with my mentor basically all day. I still had my own caseload, but I was always practicing like with them present. I had a lot of questions, and also the hospital was new to me after a year of peds. And then as like I went through my residency and got more comfortable in the hospital and my clinical skills increased, it was more of myself just treating my own caseload. But that was also dependent on which setting I was in, which service I was on. So obviously later on in my residency, when I went into critical care, I again had a mentor with me most of the time until I had to make some more experience there. But it was, you know, regular hours. So for us, that at the time was 8:30 to 4:30, Monday through Friday. They didn't make me work weekends or holidays as a resident, but that has now changed as staff.
Awesome. I'm sorry about the weekends. That's tough. Okay, Lewis, same question. So what was the format?
So we kind of work in a open format where Kevin kind of has his schedule, his patients, and we worked as a team-based setting. So it was sort of myself, Kevin, an athletic trainer, and maybe another athletic trainer, and then an aide. And it was kind of, you know, patients sort of roll in as they roll in. You know, you tell them 8:30, they show up at 9, and it is what it is. But we kind of co-treated everyone. It's very, very systematic. So I had to first kind of learn the system, learn the exercises that they like, kind of learn the range of motion techniques, etc. Not a formal didactic. And then it was a Monday through Friday, kind of 8 to 5, 7:30 to 5, depending on the week. A formal in-service every Monday afternoon from either an MD, a resident, you know, a surgical fellow as well, or given by someone like myself. So I had to do some presentations for that as well. Same thing went for Friday mornings. So there's an in-service every Monday afternoon, every Friday morning. Weekends, he was doing a lot of educational courses on the weekends. So I would go in and sort of help with the back end on that, helping with kind of filming courses or maybe going over some materials or even treating a couple individuals that needed an additional 6-day kind of a Saturday session. Then there was a couple informal opportunities in OR observation, a clinical observation with a couple of the MDs, and then obviously research was a big component of it as well. So sort of setting up my own presentation and then doing more informal projects such as kind of manuscript reviews and textbook edits and all the other fun things that we had going on, and then a couple weekends of travel for educational courses as well, and sidelining some games. So a lot of work, but it's kind of that time where you're in this state that you've been working towards, and you're working with someone that you want to learn from, so it doesn't really feel like work. I was also living by myself in Alabama during COVID and had no friends, so it didn't matter to me. I didn't really care. So weekends was like plans for me. It was cool. That being said, it's a lot of work, but it's rewarding, and you're finally kind of really doing what you're passionate about, or learning more about what it takes to kind of succeed in the role of what you're passionate about. So
Yeah, so what I'm hearing you say is that you had like one-on-one clinic time, and then you had educational presentations that you had to go to, and then you had to prepare your own educational presentations, and then you had sideline stuff for sports, and then like OR time, it sounds like. So that is a ton of different stuff.
yeah, it was great exposure into multiple avenues. And I think the biggest thing about what I got to see was kind of that multidisciplinary approach, and kind of learn from athletic trainers and learn from MDs, and have the communication aspect between all of those. So it wasn't just like a physical therapy setting. It was like doctor could see someone and give us a call and be like, hey, I just saw someone. I want them to get a quick session in. I'm going to send them downstairs. And that's kind of what it was. So a lot of different exposures to things, which was why we took up time. But in the day to day, it was kind of an 8 to 5 in terms of treatment, and then the occasional Saturday for specific individuals.
Okay, awesome. Thank you. That's great news. All right, Amanda, same question. What was the format of yours?
So Siskin Hospital's residency is a little bit different. I stayed on as a full-time therapist, so I did get paid a salary. It's a little bit less compared to the traditional starting salary, but compared to other residencies, it's a significant amount, because a lot of times residencies either, just like you said, get paid a stipend or a small percentage. So you do start basically as a full-time staff therapist, their starting salary. But that being said, I carried my own caseload. It was a little bit less compared to others. So typically you'd see anywhere from, you could have 10 to 12 on a caseload. So I carried 8. And that allowed, so I treated 8 to 4:30 every day. Wednesdays was specific mentor time. So I had a whole morning of 4 hours of treatment where I had co-treats with my mentor, or I would lead and they would be present and give me like second set of hands as an aide would. And it was interesting in the way that my residency was formatted, because I did 4 different rotations. One was on our stroke unit, one was on our spinal cord injury unit, one was on our brain injury unit, and then my last one was, it was kind of like a float rotation. So any like really interesting diagnosis or rare diagnosis, it got put on my caseload, which was really nice, because I got some exposure to cases that I don't feel like you get to see often. And then I also went to outpatient during that time and did some vestibular treats with one of the vestibular therapists. And working full time, I also did have the didactic work that I had to do. So the residency I did use the Institute of Knowledge Translation's curriculum. So neuro residencies, a lot of times they'll outsource their curriculum. One of the biggest one is Neuro Consortium. Institute for Knowledge Translation is up and coming. I really enjoyed their curriculum. I thought we got a lot of great study resources, especially. So it's kind of a learn as you go, but we did have weekly mentor sessions. So for us, it was Monday nights. It was about an hour and a half to 2 hours. So after work, I would be on a Zoom call like we are now, reviewing the article that we had to read for that week, or clinical practice guideline. And the other residents that were also part of the curriculum around the country were on Zoom, which was really cool, because you got to connect with other students going through the same thing you're going through, and kind of working through information, and talking about how that the research that we just reviewed is impacting your care. Or we were dealing with COVID during the time of my residency, so just how that was impacting our care. So I worked Monday through Friday. I did have to work, because I was technically a full-time therapist, I did have to work a few, I think it was one weekend day a month. And then you selected holidays just as you would if you were a full-time therapist. That being said, though, I did feel like my resident director really was empathetic in the sense that, like, if I had a lot going on, I could let her know that I was stressed and she find someone else to work that weekend for me. And that was pretty flexible. I also had opportunity. I mean, I did have to do lunch and learn presentations as well. So any new or exciting research, I did a presentation on it. I picked my research project was a case study. It could be from any one of the units that I was on, and just writing up a manuscript. It was a lot. So I didn't actually be able to publish it by the time I was done, but I'm still working on trying to get there, just juggling everything. It gets to be a lot. But for my residency, that was not a requirement. You didn't have to publish, you just had to have the manuscript done. Other residencies might be different. And then I did have opportunity. We were attached to a big acute care level 1 trauma center in Tennessee. So right across the bridge, it's Erlanger Hospital. I had a lot of great just clinics that I was able to observe there. I went to Huntington's disease clinic and an ALS clinic. So patients that I don't feel like we get to treat so much on an outpatient basis or inpatient basis, I did get exposure to a couple times throughout my residency, which I thought was really great. And then I looked at serial casting. I shadowed the Botox clinics, baclofen pump, refills, and just it was very cool. I had a lot of different opportunities.
Yeah. Wow. So you were really exposed to a lot, and we will definitely keep an eye out for your byline in a PT journal one of these days. That's very exciting. So you touched on this. So I guess this question is more for Lewis and Caitlin. Did you pay tuition for your residency program? If yes, do you mind sharing what the cost was, or if there was financial aid support? And if you didn't, did your employer require any work contract for a period of time after the residency was completed? So let's start with Dr. Crandall.
So my residency did have a tuition, and it was $6,000. And then we also residency salary wasn't as much as staff PT. But there was no financial aid available, and there was no work contract. I didn't have to stay on as a staff afterwards. I chose to.
Awesome. Thank you. And then what about you, Lewis?
No, I did not have to pay. I was hired as a kind of per diem employee with a residency salary. So it was less than a normal full-time treating therapist, but no tuition for the program.
Great. And then no work commitment either.
What do you mean by that?
So some programs, if they put you through this program, they basically say you have to work for them for 3 years after in order to pay them back, essentially, for covering the cost of educating you.
None of that.
Great. Awesome. That's great to hear. So next one, were any of you required to sit for the specialty exam? Did you have enough hours at the time of residency completion to sit for the exam, or did the residency itself count to sit for the exam? And then do you feel, sorry, it's like a multi-part question, do you feel like the residency made you more prepared for the specialty exam than you would have been otherwise? So let's start with Caitlin again for this one.
So acute care obviously is very vast, right? And I didn't mention it before, but I rotated through all the units in the hospital. So ortho, neuro, peds, cardiopulmonary, PICU, NICU, MICU, you name it, I was there. So when I decided to pursue the CCS, the cardiopulmonary specialty, I did have enough hours because obviously in the medical units, you're seeing a lot of heart failure, a lot of pneumonia. And then obviously in the CCU where I work now and where I spent a lot of time as a resident, you're seeing, again, heart failure, but worse. We're working with ECMO, balloon pumps, Impellas, VADs, post-transplant. So I had enough hours just because of what I saw during residency. And 1,000,000% residency prepared me so well for that exam. just the didactic part alone. So the didactic, it did start 2 months before residency, but it continued through the year and a half I was there. So it was a lot of didactic stuff. And then just what I saw working at NYU, we see things and do things that most medical centers don't. So I had a lot of experience, which really helped me with that exam.
Yeah. Wow. I bet. Great. Lewis?
So I did not sit for my specialty exam just because the SDS requires you to have a certain number of clinical hours. Did I feel prepared to sit for it? Yes. But just because you need a certain amount of clinical hours under your belt, I did not sit for it following my like residency fellowship type thing. So that is something in the works potentially in the near future. So
Yeah,
stay
I hear
tuned.
that.
So yes, but I did not take it right after for the hours, but I did feel prepared.
Great. Amanda?
So sitting for the specialty exam was part of my residency. The hospital actually paid for the exam. However, if you did not pass, you were responsible for paying them back. So there was a little bit of some external pressure. The cost of the exam, I think, is like $2,700. So nobody wants to be out that money. So studying took on a whole different meaning for me. But no, I mean, the residency totally prepared me for the exam. Kind of what Dr. Crandall was touching on before, the experience in itself, I think, gives you exposure to so many different cases, and just allows you to tap into all of the different patients that you've worked with in the case questions that they present on the exam. But my didactic work, they gave me so much material, so many different resources to work with, because it can feel overwhelming. It's not like the NPTE where you have a book to study from. It's look at all this up-to-date research and figure it out. So you have someone kind of, structuring your study time and showing you, okay, this is a great resource to look at. This is the most up-to-date research. So I did think it was immensely beneficial. In my residency, I was required to track all the hours that I worked with specific patient populations, because for a neuro residency, you have to have exposure to certain number of CVA, certain number of brain injury, certain number of spinal cord injury. So I was able to easily get I think 2,000 contact hours that I needed. So
Great. Okay, so you guys all touched on some stuff that are covered in my next couple questions. So we're going to skip a couple. And then I'm interested in hearing about what residency training has done for your careers. So I know a lot of our students are kind of curious as to like what their 5 and 10-year plans might look like. And I'm interested in hearing from you how you feel residency has sort of factored into that. So can we go back to you, Amanda?
Sure. So I think residency really kind of propelled my career. I did teach this past semester at Russell Sage. I did the adult neuro rehab lab, and I had so much fun. And it really, let me help communicate all of the up-to-date research that I had to the young professionals that are entering the profession. And I think it also allowed me, I kind of touched on this before, but that confidence piece when you're practicing is huge. And as a new grad, that's a tough thing going into a field where, like I said, we have so much knowledge on so many different patient populations, different body systems, that it was empowering to kind of feel like, okay, I am honed in on this one area, and I know what I'm talking about for neuro. So I think that that's really helpful when you're practicing. I also just think, when you have a specialty, you're given a lot of times patient cases that are challenging and more complex, which allows you to further hone in your skills. And also, I'm training a few therapists right now at Sunnyview on spinal cord injury. And the high intensity gait training is something that I've been training other therapists on. And I am a part of the Sunnyview research that they're slowly starting to come out with. So yeah, it's exciting. I think it allows more opportunities for you.
Awesome. All right, Lewis, next.
Yeah, I can't speak enough on what it's done for me. I think the biggest thing is the networking aspect. I guess the amount of people I've met through that hospital network, not only other PTs who have done that same fellowship residency that I did in past, who have sort of helped me navigate my career and given me advice on where to go from that position, and then additionally meeting up with surgeons and learning how to communicate with other medical professionals kind of brought me to where I am. So I'm fortunate to be in a group where our two primary sports physicians also did their orthopedic fellowship at the Andrews Institute with Dr. James Andrews, who obviously then they were introduced to Kevin as well, and they kind of paired me up. So we have a very similar system up here where if I want to go grab lunch or I want to go to the restroom, the doctors are right next door and I have to say good morning or good afternoon or talk to them about a case. So it kind of allowed me to get into a position that I really wanted to get into, where I have that open line of communication. And then additionally, just networking outside of that, having been able to meet with the likes of like Ashley Campbell and get involved with the International Journal of Sports PT and start helping with some of those avenues, being research, and then additionally like rehab products. So having been introduced with people at Hyperice and kind of working with them as well. I mean, it's not only the clinical knowledge and the ability to get a better position or be connected with physicians to get a position that you feel you'd much rather have, but getting introduced with a broader network with someone who's been in the industry for a while has. So you can kind of cast your net a little bit wider with those positions, and then I think really propel into something that you want to do. And most often these residency programs are pretty well established and a pretty well run system. So when you get into a facility after that, you'll sort of know if that's well run as well, and have an understanding if it's not as well run, what does it take to make it as well run as something that you were accustomed to doing. So again, like I said, fortunate to be with physicians who share that similar mindset and that same experience that I have, and sometimes not so fortunate when they send me a lot of patients that maybe I don't have time for. But no, it's good. I mean, it propels your career, and it just helps you meet a lot of people that you may not have, and can take your career into a path that you may not have expected it to go into, but for all for the better.
Great. And then Caitlin, how do you feel about that?
I don't even know where to begin, honestly. So by the time I was done with my residency, like I said, I'd rotated through all the units in the hospital, and it usually takes a staff physical therapist 3 years to do that. So I did that in a year and a half. So obviously a lot of training on many, many different patient populations. So I'm able to train new staff. I'm able to take students. I also have been involved a lot in research from my residency. So I had to do research. I did 2 poster presentations of my own, and then this upcoming CSM will be my 3rd educational session. During my residency, I got involved with the Academy of Acute Care and have been developing clinical practice guidelines for acute care for the past 3 years. So those should be coming soon. So a lot of research opportunities. I've been involved in quality improvement projects at the hospital, was a founding member of our wellness committee, and I'm also in communication with St. Pete's and Albany Med up there to get a better staffing in the ICUs upstate as well.
Really cool. That's great. Okay, so last question, and then we're going to open the floor for questions from our students. And it's a multi-part question again, so sorry. But what was your favorite thing about doing residency? What was your least favorite thing? And what advice would you give to any student? So let's start with, I'm just going through my line here. Let's start with Amanda again.
So I think my favorite part of residency was the fact that I got to learn from 4 different mentors. And they're therapists that I wholeheartedly respect, and I learned so much from them. I just really appreciated having that quality time where, they were able to really just kind of take time where we were one-on-one together and explain things and show me techniques. And I learned so much. So I think my growth as a clinician was my favorite part of the residency. And not only growth as a clinician, I think you grow as a person as well. And then my least favorite part, I mean, it is so much work. I was stressed out. I was also planning my wedding at the same time. It was COVID. I feel like, it's just a lot. So I think you just have to be mentally prepared if you choose to do a residency, that it's going to be a lot of work. You have to buckle down. And there were times where, I didn't get to do certain things on the weekend because I had to study. You make decisions, but ultimately, I think the reward at the end of the residency is so worth it. It's a lot of work, but tell yourself that it's only a short period of time. It's not going to be like that forever. But that was probably my least favorite part, was just the amount of work that it entails, because it's a lot.
Well, and I think that was great advice. So nothing is forever, right? Lewis, how about you?
I would say my least favorite part is similar to my favorite part. It was kind of figuring out how little I truly knew about what I want to do, but then being exposed to learning how to do what it is that I do want to do, not only in a clinical sense, but kind of what it takes to do these things in a non-clinical sense, in terms of connecting with physicians and athletic trainers and a community, and building the trust and the network of not only your patients, but everyone that surrounds your patients, those that are operating on them, those that are kind of caring for them during and after. And then, yeah, like I said, just the hard part is you think and then you kind of work with someone who's been doing this for a whole lot longer than you, and you pick up on things, and there's times where you're going to feel kind of like an imbecile, to say the least, or you might suggest one thing, but it's okay, because you kind of learn from that, and you have someone to kind of show you the ropes and teach you better ways to do that. And I think you have to be open to accepting that criticism and being challenged. And I think something I tell the students that I work with now is kind of the favorite question of mine is, how could I have done that better? I think, you kind of maybe do a practical, or you do X, Y, and Z in the clinic, and, that was great. That was good. But how could you be more efficient? How could you have been, communicating better with the patient in the bedside manner? All these little nuances. So I think the challenge is tough, but if you're willing to accept that challenge and more so embrace that challenge, then it's obviously going to be the most rewarding thing you kind of can do and sort of propel you forward.
Yeah, that's great advice. Attitude matters. And Caitlin, last one, but not least.
So I think my favorite part was just learning everything I learned. I got to see really cool stuff like triple organ transplant. I got to work with a face and bilateral hand transplant patient. So just seeing just all this incredible things that medicine can do, and then seeing physical therapy's role in that. And being able to help people who they're in the hospital, they can't walk, they think their lives are over, and rehabbing them and seeing them go out and get back to their life. That's an absolutely incredible feeling. My least favorite part, a little bit of what Amanda and Lewis said, being criticized a lot is really hard, and nobody likes that. But if you pursue a residency, you have to be mentally prepared for, as Amanda said, the stress level, the work level. That's never going to go away as a resident, and also being constantly given constructive feedback. And it feels like a lot sometimes, but overall, that's what gets you to be like a high level clinician.
Yeah, that's great. Okay. Well, thank you guys for answering my questions. Now we'd like to open the floor. So if you would like to ask a question of our panel, please use the raise hand function or drop it into the chat. And if it's in the chat, I will read it, or Dr. Ayosa will read it. And if your hand's raised, one of us will call on you. So ask away.
I just quickly want to say thank you to Amanda and Caitlin, because I could never see the patients that you guys see, I would feel so lost. I wouldn't know what to do. So thank you guys for taking care of all that. It seems like pretty crazy and incredible experiences. And thank you for being experts in that field so that I don't have to be. Not that I don't have a passion, but I just think you guys know way more than I do. So that's awesome.
Well, I feel the same about, sports. I feel like being so immersed in neuro, you lose a lot of your manual skills, and just like my husband's a TPI certified golf physical therapist, and our days are completely different. And it's like, okay, so thank you for what you do as well.
I've basically forgotten ortho, so likewise, right back at you.
No questions from any students?
There's hands raised.
They're not showing up for me. I'm sorry.
Yeah, that's okay. I'm just gonna go across my top. So it looks like Arthur.
Yeah, so I have a question for Dr. Lupowitz. It's can you talk more about your patient population that you saw during your fellowship? Like, I know ASMI, they deal with some professional athletes, but also general ortho as well. So if you could talk about that, would be great.
Yeah, so I was fortunate to kind of see both ends of that spectrum, having started as a student. So I started as a student where, my CI, my CI kind of saw, everyday patients, sort of general ortho, and then the occasional, high school collegiate athlete. Sort of being in the same clinic as Kevin Wilk, you're not going to see too many professional athletes because he's kind of going to see most of them, to just be quite honest. And then when I sort of transitioned over to Kevin, we kind of had a morning shift and an afternoon shift. So 8 to around 1 was sort of reserved for professional athletes or a collegiate athlete that was either off or able to get in, or someone who was referred to him directly by a physician or someone in the community who maybe he treated in the past. So sort of a mix of both. I'd say the morning, if we saw around 20 people in the morning, it would be about 10 to 15 pros or high level collegiate and about 5 to 10 general orthos. And then in the afternoon, it was more high school and general ortho as well. So kind of kids that needed to get in after, and those could be a regular high school athlete or a high school athlete prepared to go to Alabama to play football the following year as well. So, I mean, it all varied based on what the caseload that day was. And then every Friday morning, we would have about anywhere between 2 and 6 day 1 UCL post-ops, because that was when Dr. Dudius and Dr. Kane would do their UCLs. Was on a Thursday, was an operating day. So Friday, people, would kind of fly in from out of state, out of town, wherever that may be, get their surgery on Thursday, stick around for Friday, sometimes Saturday, and then either drive or fly home. But we would kind of handle that first day of treatment. So again, a mixed bag where with my CI, we sort of saw general, and then with Kevin, a mix of pros, run in the mill, and everyday walks of life.
Good, thank you. Abigail, did you have a question?
Yeah, I do. So I know the terms residency and fellowship are kind of used interchangeably, and I know 2 of you guys did residencies, but 1 did a fellowship. Can you guys talk about like the difference between the 2? Because I know personally, I know 1 fellowship that I'm interested in requires a specialization before it, so I know all of those requirements change. So if you wouldn't mind kind of like differentiating the 2, that would be great.
I'll speak on mine. My fellowship is not 100% an accredited program. I do know that most fellowships require you to do a accredited APTA residency that sort of prepares you for a specialty exam before entering their fellowship. So a fellowship is kind of a post residency training in a specific area of interest, whether that be sports, orthopedics, cardio, neuro, all the etc. But it's kind of a more advanced training following your residency. So the residency sort of prepares you to become sort of an entry level specialist, whereas a fellowship prepares you to become more of an advanced clinician in that area of interest. And correct me if I'm wrong, but I think that's how it was explained to me and sort of how I understand it.
Thank you. Amanda or Caitlin, did you have anything to add? No? Okay. Ashley?
So I know it was kind of different for all of you guys, like some of you were employed prior. But like if you were just a fresh applicant that had no ties, like what kinds of things like make you a good candidate? What kinds of things are they looking for in a resume to come across their desk? Or like what's going to make them stop for a second and be like, okay, this isn't just like every other resume that's come across my desk.
I can speak to, I didn't actually like sort through the resumes that came in after I completed my residency, but for the next resident, I did sit in on the interview. So there were 3 candidates that came for in-person interviews. And really, I think the thing that stands out the most is being personable, really connecting with the other physical therapists and being open to learning, being open to criticism, because that is like all of the other panel, all the other professionals on the panel, you know, that is such a hard piece that you have to get used to literally all the time. So I could tell, you know, just by interacting with people in the short conversations for interviews and showing them around the hospital, who's open, who's willing to, you know, converse, who's ready to kind of learn. So I think just really, you know, being yourself, but also being open to the idea that this is a time of learning for you. You're not going to know everything. Was a piece that really kind of, I think, helped make our decision for the next resident. And I think also showing an interest prior to, you know, doing the residency or applying for the residency. So for like a neuro specific residency, taking some time to volunteer at you know, different clinics that specialize in neuro, or getting involved with some sort of research if you can while you're a student in a neuro-based program or something like that, just to kind of or like I said, I had a family member that was a personal connection, just something that kind of, what makes you interested in this area of specialty and why is going to be big.
I think additionally it comes down to, it's not only a residency for you, but it's their time as well. So do you actually make a connection with that individual, you know? And if even on your end, if you don't really feel as though you do, then it's not going to be the most enjoyable experience for you as well. You're going to be spending a lot of time with this person and learning from this person, and they're going to be spending a lot of time taking out of their life to invest in you. So I don't know if anything necessarily on paper always makes something stand out. I think it's, at least from my perspective, it was more kind of that interaction and that personal connection of just kind of seeing how you work with an individual in the same setting and how you just connect with them as a human on a day-to-day basis. Like, would you be friends with them? And now can that friend sort of teach you a thing or two? You know, you study with the same kind of group of people, I would assume, like in your class. To be transparent, you have a big class. I'm sure that you've found your few closer knit friends. I would hope that you're all best friends, but no, to be honest, I mean, you know, you kind of find your crowd, and hopefully that crowd can be a mentor to you. And then from there, just kind of, you know, realize you're spending a lot of time with them. So hopefully there's a connection that just sort of naturally happens during that interview process, and it's a good fit on both ends. And from there, so like Amanda was saying, be yourself, show your passion, and hopefully that person has similar interests as you, because you're going to hang out with them for a long time, whether you want to or not. So hopefully you're going to want to.
Yeah, and I second both Amanda and Lewis. So there are some things in your control. You can do the research, you can volunteer, you can have as expansive and impressive as a resume as you possibly can get, but you also need to show up there and be yourself and click. That part's out of your control. To be there, and who is able to tell them why they stand apart from all the other applicants. Like, why do you deserve that spot? Like, what are you going to bring? What do you have to offer? And what is your plan after residency? How can you take what you learned and use it to benefit the most people you possibly can.
Thank you.
Great question. Thank you. All right, Asan?
Yeah, my question is for Dr. Lewis. So just in my own research, looking to do like the SCS residency, I've also seen like some PTs are also like certified athletic trainers. Like, would you recommend going that route and doing both, or would you recommend SCS? Is like, which one would you rather, or is most beneficial?
I think it depends on where you want to work. Following that, my mentor, quite frankly, told me, don't do an SCS. He goes, you did a fellowship with me, you don't need an SCS. You kind of learned it. It's just letters, it's fancy. That being said, some positions that you may want in the future require an SCS, unfortunately. I know that if you want to work in the NFL, you need to be an athletic trainer as a dual trade as a physical therapist. So I think it's understanding, kind of like we were talking about, what's your 5-year, 10-year plan. If that's to go into the NFL, then I would say go get your ATC degree instead of your SCS. But if that's just to get into a fellowship in, I don't know, maybe a specific baseball or basketball fellowship that requires an SCS, you better have your SCS. So I think it's a matter of maybe looking past what the next step is, kind of almost like chess, go 2 steps ahead, see what's required, and then kind of fill that middle spot with what's needed. I'm fortunate where I work with enough athletic trainers to kind of get their hands-on skills that I didn't need to get my degree. But if I knew any better and didn't switch career paths kind of late stage in college, I probably would have went for athletic training right off the jump, because those guys know a ton.
Thank you.
I think that's all the hands that I have up. Does anybody else have any additional questions?
I have one question. So I wanted to speak, my name is Guy, sorry. I wanted to ask, how was your quality of life going into your residency right after grad school? I know some of you worked a job right after grad school, but I wanted to just kind of get a feel for how it was. Did you feel like it was all manageable, like the workload, or did you ever feel burnout? And how was it coming out of that residency? Did you want to dive right into work with all your newfound abilities, or did you kind of feel like you needed a break?
So I think, like we said before, it definitely is stressful. But at least for me, my mentors, I was also working like at NYU during COVID, and for a while, New York City was the epicenter, right? That really sucked. But I had really great mentors. I had really great coworkers who I could go to for support. I also think a lot of it falls on you. Like, you guys are all in a graduate program and a doctorate program. There's a high level of stress involved in your life right now. So hopefully you're developing coping skills and self-care practices that you can take as you graduate and you are in a clinical position. So just leaning on the self-care practices that I developed personally, it was definitely manageable. I'm sure it was more stressful because of COVID, because we were all in lockdown, but still having to go to work for at least me. So that was, scary, but manageable. Coming out of residency, it was different because I felt like my mentors were still there, but they weren't formally mentoring me. So there was a little bit of, I kind of felt like I don't even know, like I was on my own, like I was flying on my own, which was a little nerve-wracking at first, but I quickly got into the jive of being a staff PT. But I think all in all, it's manageable if you set your mind to it and you make sure you take care of yourself and that you have a good support system.
Thank you.
I'd have to second everything that Caitlin said. I think it's unique because I'm pretty sure all of us did our residency and fellowship during COVID. So, that was a whole other layer of stress. But one of the questions I was actually asked during my interview was, how do you manage stress? What healthy coping mechanisms do you use? So that was something that I knew right off the bat, this is going to be stressful and I need to take it upon myself to make sure that I'm dealing with the stress in a healthy way. Making time for what you love to do. So like for me, it's running or doing yoga. And I made sure that I created time in my study schedule where that is not something that I passed up on. It's definitely manageable, but it is a lot. We'd be lying if we said that it wasn't a lot. It's definitely a lot. And as far as like coming out of it on the other end, another resident had already started. So kind of like what Caitlin said, the attention shifted off of you at that point, and you're like, okay, I sat for my board exam and I'm doing what I need to do to just practice and treat my patients. So I think, you know, it is a lot on you, but if you have healthy coping strategies and you have friends and coworkers where you can lean on and talk to, my residency director was also great. I think I was allowed 7 days off in the entire residency program, and I wound up exceeding my hours. So she was able to like give me more days off, which helped because, you know, when you think 7 in the grand scheme of over a year, that's not very many. So, you know, there are definitely ways around making sure that you're okay. Nobody wants you to not be okay during the residency.
Awesome, thank you.
Any other questions from our students? Am I just not seeing hands again? Okay, good. All right, well, I want to extend a serious thank you to the 3 of you. This has been really helpful, I think, for our students. It's been really interesting to hear about your different experiences. Dr. Ayosa and I will contact you after this is over to bother you about sharing any contact info you might want to share with our students in case they have other questions or want to, you know, pick your brain about the whole process. For the rest of the students on this, if you came in a couple minutes late, I am dropping first a link for attendance into the chat, and then a link to the forums for the student drive. And then I'm also going to drop one more link for a podcast that is on pursuing a residency program. Dr. Ayosa and I both listened to it and we thought it was terrific. And it is just some more food for thought if this is something you're seriously considering, you know, as a professional move after graduation. Other than that, if you have your forms and you need them signed to get credit, Dr. Ayosa and I can handle that. We will send an email out tomorrow about that. So please be looking out for, I know you get a million emails, but just one more from us. But with that, I think we can conclude our fall professional speaker series. And again, thank you to, you know, Dr. Amanda Awesomes, Dr. Louis Lupowitz, and Dr. Caitlin Crandall. You guys have really made this a really special event for us. So thank you.